A disturbing medical trend among young, healthy women to warn you about today. Doctors at TriStar Summit Medical Center say more women are coming into the ER with blood clots. News Channel 5's Amy Watson went to the hospital to find out why.
I had a bruise that was probably the size of a $50, and it just had like red streaks coming off of it, and that was really all I had.
In July, 30-year-old Gretchen White just had a sore elbow, but within 3 days, this TriStar Summit ER nurse checked into her own ER as a patient.
One of the doctors down in the ER was like, this may be a blood clot. And I was like, okay. So I checked into the ER, did an ultrasound, and there was a blood clot from my elbow to my armpit.
It was a blood clot, and Gretchen was scared.
Traveled to my heart, my lungs, my brain. It could have caused me to have a heart attack, a stroke. It could have caused death if I hadn't have had it checked.
It's a very, very common cause of preventable, in most cases, deaths amongst Americans.
Dr. Tiff Saragusa says risk factors include obesity, smoking, a sedentary lifestyle, or using birth control. Gretchen was on birth control, her only risk factor. But with more young women having clots, I asked Dr. Saragusa if there is a connection.
I think that oral contraceptives are becoming more prevalent. People are becoming more aware. I don't know that really there are more women right now developing blood clots, but maybe we're just detecting it a little bit better. The public is more aware.
He's seeing about 12 patients a month with blood clots right now, both men and women of various ages. But if you are taking birth control, you should be aware.
It's good to know your family history because, as I said, there are millions of people on oral contraceptives who will not have a blood clot. But if somebody knows they have a family history of blood clots, it might be a good idea to have their blood checked.
Gretchen is doing just fine now after taking blood thinner pills. And glad she's caring for patients again, not the other way around. Amy Watson, News Channel 5 HD.
And Gretchen will have a final check next month to find out if the clot is completely gone or if more treatment is needed.